Good day, ma'am. I'm Dennis Kate Cabiedes and I will be performing the wee bag attachment checklist. So to start, first is to gather the equipment that I will be needing. So here I have prepared my urine bag, clean gloves, sample container, and I have also prepared the soap and water on the wash area. Next is to check the doctor's order. So the order sheet is the most reliable source and legal record of the patient. Then, explain the procedure to the mother or the significant other of my patient. So this helps minimize the anxiety. Good day, ma'am. I'm Dennis Kate Cabiedes and I will be your student nurse for today. So I will be doing a wee bag attachment to your baby, on which I will be using a special bag that is made fit over your baby's genital area. So this will collect urine samples from your baby. Then, identify the client. So here I will be checking the identification bond, on which it consists of the name, birth date, and or medical identification number. Rationale. Identifying patients accurately and matching the patient identity with the correct treatment or service is a critical factor of patient safety. To prevent instances of misidentifications and near misses, the Joint Commission requires that two identifiers, such as patient's full name, date of birth, and or medical identification number, be used for every patient encounter. Then I will now perform hand hygiene. And apply clean gloves. So this reduces transmission of microorganisms. Then provide privacy to avoid unnecessary exposure of the body parts. So here I have already closed the curtains and the doors to provide privacy to my patient. Next is to wash perineal area thoroughly with soap and water as needed. So washing ensures area is not contaminated before putting wee bag. Then, dry perineal area thoroughly. This is to ensure that the urine collector will stay in place. Now I will be changing my gloves. So I will remove and discard my gloves. And will be performing hand hygiene. So this reduces transmission of microorganisms. Now I will be removing the wrapper of the wee bag. Make sure not to touch the inside part of the wee bag because that is sterile. Then, know the midline. Then peel off the protective paper. Now, I will press it near the anus, going up, then spread, and I will press the adhesive firmly against the infant's skin. For female, make sure the hole of the wee bag is exactly placed in the meatus of the baby so that the urine will not leak. And for male, ensure that the wee bag is placed on the penile shaft of the baby. Then, I will now be putting the diaper, making sure that it is not too tight. So, rationale, this is to avoid the urine from leaking. Then, I will check the bag at least every 15 minutes until an adequate amount of urine is collected. So, do not leave the bag on for more than 1 hour. Take the bag off if the skin develops irritation and or symptoms of allergy. This is to check if adequate urine is already collected and to avoid leakage. When adequate amount of urine appears in the bag, I will now remove the bag gently. And I will transfer the specimen to an appropriate container. And I will be placing a sticker on the body of the container, which includes the name and the room number of my patient. Or I can also fold the two adhesives together, then seal it, and then place again to an appropriate container. Then put sticker again to the body and not on the lid. This sticker includes also the name and the room number. So, rationale, this is to avoid contamination of the urine specimen. Then I will now discard again the gloves. Now I will fill out the requisition form and send it to the laboratory with the specimen as soon as possible. So for best results, bring the sample within 30 minutes of collecting it. Then I will now perform hand hygiene. And will be documenting the data. So that's all. Thank you so much.